The pandemic is moving around the world quickly, with areas in Asia and some countries in Europe moving away from some of the more extreme community measures associated with lockdown. Although this is not necessarily without danger, as we've seen recently in countries such as Israel, Belgium, Spain, and also in Africa. The methods and pace selected to end the lockdown and achieve greater freedoms vary from country to country, and this would appear appropriate given the different socio-economic factors at play. What is more surprising is that few are using more technologically precise methods to do so, like digital certification, which allow a more personal approach to social isolation and the potential to better manage the return to work and economic well-being. It is likely that despite a few outbreaks in different parts of Europe and the Middle East, and no doubt some re-emergence of significant transmission, we are seeing a reduction in the figures of the number of deaths associated with the pandemic. This relative respite offers an opportunity for us to prepare for the next wave and ensure the response is more coordinated, precise and effective. The first wave has taught us that countries that adopted a strategy of go hard and early achieved better outcomes, such as in Denmark and New Zealand. This approach was particularly prominent in countries where SARS in 2003, swine flu in 2009 and MERS in 2012 caused problems. They had a coordinated response and appropriate infrastructure in place, including track and trace systems, while also having pathways for flows through hospitals and primary care centres to ensure that the populations of potential COVID and non-COVID patients did not meet, thus ensuring that places of care did not turn into hotspots of transmission. Furthermore, they also of course had adequate supplies of PPE and the logistics set up to deliver and maintain supply. The World Health Organization has been advocating for many years to strategically invest in digital health and digital health systems, boosting new models of service delivery to educate the population on the role of digital health in prevention, care and monitoring, said Dr. Hans-Henry Kluge, the World Health Organization's Director for Europe during the Future Med conference last week. He noted that the coronavirus pandemic has boosted the adoption of digital tools and scaled these technologies. However, going to the next digital age, he warned that it's important to learn from the past. Although forecasted peaks are not expected to reach the same patient volumes as the first wave in the UK, for example, this is the opportunity for each health system to level the playing field and embark on recovery planning and response strategies which will be incredibly important to ensure sufficient capacity to deal with an expected rise in patient caseloads. So what should we be doing now? 1. Catch up. This is the time to reprioritise. We've seen departments like cardiology and cancer services seeing far too few people over the past few months. We're seeing an increase in the unexplained deaths globally, and it's likely these patients are a percentage of these. We should also factor in the major need to address levels of mental disorders, some associated with the stress of the pandemic and some with the stress of lockdown. 2. Managing non-communicable diseases using digital tools. The shift to digital modalities in primary care was particularly noticeable globally, as well as monitoring of non-communicable disease. Often these changes took place in a matter of days or weeks, and in some instances lacked the scrutiny of experts to ensure proper governance and interoperability was baked into the new ways of working. Now is the appropriate time to revisit these systems to achieve this, and also ensure that proper cybersecurity is maintained. The improvements to care we're likely to see in the post-COVID world will be significant, as opportunities like personalised clinical decision support and clinical governance around data entry become part of the mainstream. 3. Primary and community care. We know after the first wave of COVID that some pockets of the population are more at risk of developing complications from coronavirus. From the obese to people from black and minority ethnic backgrounds to people with concomitant non-communicable diseases. Primary care should be identifying these in their EMRs and setting up processes to ensure they're safeguarded where necessary and guarantee they're suitably prioritised for treatment should they develop COVID during the next wave. 4. Hospitals and hospital systems. Hospitals need to revisit all their plans in the light of lessons learned from the first wave. The potential to set up digital systems to register visitors to ensure that every possibility of spread is managed, as was the case in Singapore, should be considered. There are options to reduce the likelihood of major hospital outbreaks and, most importantly, minimise the risk of infection and transmission. Digital tools are important elements in this agenda, said Benedict Tan, Chief Digital Strategy Officer at Sing Health, one of the biggest healthcare providers in Singapore, during a recent HIMSS webinar. Furthermore, 3 German university hospitals are currently piloting a computer-based early warning system for infections and suspicious cases in a smart infection control system. It's a tool that was available before COVID-19, but could be adapted to the pandemic with its specific characteristics within weeks, and is another useful example for how a pandemic virus is driving healthcare IT innovation. 5. Manage the workforce. The workforce continues to be a significant factor, and issues such as burnout must be accounted for. This is the time to set up systems to care for the people who have put themselves at risk, and also the time to ensure they're coping with the changes, particularly the speed of digital transformation. It's important that we train and nurture our most precious resource. In summary, digital tools offer huge opportunities for helping in the containment of the coronavirus and other future infectious disease outbreaks. Discussions in recent months have largely focused on tracing apps, but there is much to win in other areas too. Specifically, IT solutions that make the management of infected people and contacts more efficient. Whether a digital surveillance of quarantine is desirable is a question of which different societies will find different answers. Democratic societies should probably work towards voluntary tools with a strong focus on privacy to boost acceptance and supplement non-digital contain efforts. It's likely that the next wave of COVID-19 will come in the winter months of 2020. If it's comparable to the second wave of the 1918 pandemic, it's likely to be more lethal than the first wave unless we're prepared. It would be prudent to plan for this and be pleasantly surprised. This is Dylan Yugendra, Managing Editor at HIMSS EMEA, signing off.